Rape investigation. Street punks, great names, great people, powerful people, ordinary people, Clinton, Monica, Trump, Stormy Daniels, once in their lifetime were accused of rape, accused of sexual offenses, accused of any crimes regarding about sex. What is rape investigation? Rape investigation is the procedure to gather facts about suspected rape, including forensic identification of a perpetrator, the type of rape, and other details about rape. Only between 5 and 15% of assaults are perpetrated by a stranger. Mostly, rape victims were known by the assailants or by the perpetrators. Crime scene investigation is very important, and they never forget about biological evidences such as semen, blood, vaginal secretions, saliva, vaginal epithelial cells. All may be identified and genetically examined at the crime lab. A forensic medical examination is conducted head to toe to record all injuries from minor to severe for the purpose of recovering evidence to support the victim's assertion that a rape took place without consent. Swabbing for bodily fluid samples, saliva, semen, blood, reveals evidence that may identify or eliminate the suspect as well as the nature of the sexual activity that took place. Establishing the victim's levels of alcohol, prescription or recreational drugs by taking urine and blood samples can support an assertion that there was a lack of capacity to consent to sexual activity. Where an alleged victim of rape comes forward days, weeks, months, or even years after an alleged assault took place, it is not always appropriate to conduct a physical forensic examination. Such a passing of time degrades any useful physical forensic evidence. Where allegation of historical rape or historical childhood sexual abuse are the subject of an investigation and rely on memory as the only evidence, a form of forensic interviewing may be used to assist with the investigation. DNA profiling is used by crime laboratories for testing biological evidence, most commonly by means of the polymerase chain reaction, PCR, which allow analysis of samples of limited quality and quantity by making millions of copies. As of now, there are more advanced studies about DNA profiling, and I continue updating about how they profile DNA of the subject. Blood, fecal swabbings or the inner cheek or saliva should also be collected from the victims to distinguish their DNA from that of the suspects. Sometimes the suspect or the perpetrator is very clever and he will plant more DNA samples to divert investigation. Recent coitus can be determined by performing a vaginal wet mount microscopy examination or oral, anal if indicated, for detection of motile sperm, which are seen on the slide if less than 3 hours have elapsed since ejaculation. Non-motile sperms may be detected even beyond 72 hours after beyond 72 hours after intercourse, depending on the staining technique. In the past, the traditional offense of rape required proof of five elements: penetration, force and resistance, non-consent, absence of a spousal relationship, and a culpable state of mind. But at present, additional requirements were added, broadening the criminal code definition of rape and sexual assault to include acts such as unwanted hugging, kissing, or touching. Rape is a specific crime that is considered a sexual assault and a taboo to all cultures. There are many classifications of rape. There are one is first degree. It's a rape including intercourse with an individual 65 years of age or older against that person's will, or intercourse against the victim's will, where force, threat, intimidation, the use of a weapon, multiple parties, or the infirmity of the victim prevents him or her from resisting. Second degree rape involves unwanted intercourse where the victim does not resist because resistance would be futile, or unwanted intercourse where the victim does not resist because he or she has been drugged by the alleged attacker. Third degree rape involves unwanted intercourse with a person that the alleged attacker should have known could not consent. Date rape charges often fall into this category. There are many effects on an individual if he or she was a victim of rape. Physical, emotional, psychological. The physical effects of rape are gynecological. You can categorize it pregnancy, sexually transmitted disease, and others related to it. Psychological effects are plenty. It has immediate effects: anxiety, hypersexuality, post-traumatic stress disorder, depression, self-blame, psychological impact on men, suicide, and other things we can mention. After sexual assault, the patient usually experience a lot of social impact and mistreatment, from cyberbullying to slut shaming to secondary victimization and victim blaming. They lost their credibility. They are banned from public service and people shy away from them. Please like my channel, subscribe to my channel, and more legal issues about rape will be discussed later. Thank you.